Freak out because we are recording. If you would like to turn off your cameras and microphones during the meeting to prevent interruptions, that would be fine. We will be having a Q&A session after Edward is finished with his presentation. If you have questions, please feel free to type them in the box at any point during the meeting. In the chat box, you can direct the questions to everyone or just me, the host, and I will see them. Without further ado, I will turn it over to Edward, our CEO of J. Nolan Community Services. Edward, the floor is yours.
Thank you, Vanessa. Yeah, it's good to have Vanessa driving for us because I can only do so many things at one time, and she can do more things at one time than I can. So thank you. Thanks everybody for coming on. I know it's with a kind of short notice, but with a lot of the new information coming out, I wanted to sort of get out in front of this with you, have a conversation, or at least start the conversation, because we've got a lot of things coming down the line here to be done and ready to go by November 30th. So the main topic, obviously, today's time together is about the new vaccine mandate from the California Public Health Officer. And as you guys, most of you, if not all of you, are fully aware, I've kind of been hesitant to really kind of go down the road of a mandate. I believe that, because we're about individualization, individual choice for the people we support, that's what I wanted to maintain for all of you, our workforce as well. But also all the same while encouraging all of us to get vaccinated, to take advantage of that safety component for our community and for you personally. And I told you I wouldn't be doing it until it became required or a necessity in some other way. And we're here. We're at that day. The California Public Health Officer has included us as providers of services through the regional center, as well as any in-home services. So there's a couple of ways that we are like, yep, you're in the category now, J. Nolan. So with that being said, I kind of want to talk to you a little bit about what it means for us as an organization, kind of a timetable, give you an overview of where we're going with this and how we'll kind of roll that out. And of course, have a conversation with regard to, how you can access the opportunity to get vaccinated and or testing, those kinds of things. So first and foremost, I guess I covered it there. The mandate came out as of September 28th, giving all organizations that provide the kind of services that we provide, as well as IHSS, till November 30th to be fully vaccinated. Fully vaccinated meaning single shot if it's a Johnson & Johnson, or two shot if it's one of the two shot regimens. Secondarily, what's I guess a really important thing for us to recognize is we've had sort of a attestation process going on right now up until that point, and I said, hey, I've been vaccinated, hey, I haven't been, hey, I don't really want to disclose that right now, which created sort of two groups. If you're vaccinated, and you know it, clap your hands. No, I don't know. If you're not vaccinated, then you have, you got to wear the PPE, those protocols that all go with that. The mandate takes that option off the table. We no longer can say, hey, we'll just accommodate with PPE and those kinds of things, which again, wasn't all that different. This going forward isn't all that different because of course we've always been led by the supported individual and their circle of support in what they want in their own home or in their services from the people around them. And so we've had folks that have already said, look, I only want vaccinated staff. I feel like, health-wise, that vulnerability, it's safer for me. So we've had a lot of situations where it's been very focused in, individually to have vaccinated staff. So many of you have already kind of accomplished that working in those particular circles. This just expands that to really all of our service providing throughout the organization in all service lines. Now, having said that, I think it's important for us to kind of talk a little bit about that value of taking advantage of vaccinations being available to us now. I mean, because this is nothing new. I know this one's new to the scene, but vaccination, as far as part of our lives, is decades old. None of us were able to go to school without having our polio, our measles, mumps, rubella, our tetanus, and those kinds of things. And we've eradicated some pretty, debilitating diseases this way. And so we've been mandating vaccines for a very, very long time. Yes, this is a different way we're going about it, given that we're all right here in the midst of this pandemic situation. So it being a very fluid and aggressive situation as far as the rollout of vaccines, matching, I guess I would say, the aggressive level of the infectiousness of the disease. And so we're seeing benefit, obviously. And the important thing too is to recognize there are different populations that are vulnerable, right? Sort of in those broad categories, but we're also seeing very, very individualized situations where you're like, but that doesn't fit any of the categories we said that were more vulnerable. Why did this, 36-year-old with no underlying health issues have such a, horrible experience with COVID and almost pass away or something? We don't know all those answers. But what we do know is we have some vaccines, we have some opportunities for us to defend ourselves and to, reduce risk to ourselves and those around us. One of the things I think is exceedingly important for us to recognize is these are cutting edge. And so, yes, initially they were, like what they call emergency authorized. Right now, Pfizer, which is kind of cool. Pfizer's now reached the full FDA approval. That's a great thing. And Johnson & Johnson, I guess, is close on to achieving that as well. So again, a couple of really good things coming out in the midst of all of this as well. Just some peace of mind around those things. Because I know some concerns with regard to new things, right? But I guess all vaccines were new at one point as well. So it's a couple of really important things for me, I guess, as we start this out. I mean, there's a lot of information, emotion, meaning surrounding all of this. And what I really want to just kind of get us synthesized down to and tell you from my heart, the most important part of all of this is when we chose to work at J. Nolan, or we chose to work in this arena, we signed up to do something amazing. We signed up to do something exceedingly meaningful. And we said, hey, I'm willing to take whatever the list of risks were. If you all started with us, right, you took MANT and you took foundations, you took CPR and first aid, you knew there's a whole long list of risks about doing the job. I mean, so much so that as part of our regimen, you have an infectious, disease class, right? General precautions on how to protect yourself. And in fact, that was our first training when all this came out. I reminded everybody, hey, you've had this training, follow those rules to maintain safety. So we know there's risks inherent in the work. What also is inherent in the work is incredible meaning and an incredible change in our community around us. We have the opportunity at this moment too, to step up and lead that. We all have our thoughts and feelings and concerns about a great deal of things that go on around us. And if we weren't passionate and caring people, we probably wouldn't be in this work. But the truth of the matter is, this is now one of those things to be a part of doing this work, to being a part of staying alongside someone is, hey, all right, I'm going to protect myself, I'm going to protect you, and we're going to continue to do this work as we have committed to do it by being able to go out into community. And this is one of the tools, I look at you guys all as superheroes, right? And you got your utility belt with all kinds of tools and special things on there. This now has become one of those. Somebody's saying, yeah, but it's not a tool I would choose. I understand that. But that doesn't necessarily mean it's not a tool you need. We're going to trust one another. We're going to walk together, and we're going to say, okay, we're going to use this tool now. As I said in sort of that initial video when the announcement was made, I don't want anyone walking away from this work. I don't want anyone walking away from being a part of the J. Nolan family over this. I know how we're proud, particularly here in the United States. We got a lot of pride around, our rights and our individuality in this country, and I think it's awesome. Of course I do. but I also know that I employ an amazing group of people who have set aside a lot of things, set aside personal risk, set aside even philosophy and life, sort of rules for themselves to say, but I'm going to meet my person that I support, that I have the privilege of walking with them. I'm going to set that aside for them because that's their path. And this becomes one of those things. I've personally been vaccinated since May, and it helped reduce, for me, anxiety around what's next. It's also given me the opportunity to then go and sit with and meet in person then again with people that we support, to let them know that, in my world, in my office, where I may not be in your home very often, but you're on my mind, you're on my heart. I want you to know that every decision I make involves you. And so when we're talking about these things as mandates and rules and regulations and exemptions and waivers, what I want you to, more important than anything, remember is at the end of all of these things are people. It's people we're talking about. And, each and every one of you can choose to do a variety of things as a career, and you've chosen to do this. There will always be challenges. There will always be things that we don't agree with. Sometimes we're going to rally up and we're going to go down to the courthouse or city hall, and we're going to chant and we're going to tell them how important whatever it is on our minds is. And we've done that in the past, and that has benefited us this very year. We're seeing funding coming into this arena to do this work, to say, look, we need to have wages for people who are putting themselves at risk, who are doing this work, and you need to fund it. And they've said, okay, we agree. But they've also said, we need you to be safe. We need you, the people you support, to feel safe. And so we're going to do that, because that's the most important thing that we have the opportunity to do, is to engage and improve quality of life. That's what we do every day. I cannot thank you enough for that, because it is amazing work. It is meaningful work. I say all that because I want this in context, that there's relationships, there's progress, there's the journey you're walking. I've told you before in different videos and even live streams we've done before, I love Jay Nolan's logo, because it is simply stated that this is togetherness. We sit side by side and we both row. I want to continue to do that. This is a bit of a headwind, or a little current that we're having to row in. So we're just going to row harder, but we're going to make it happen. So let me talk to you a little bit about what we're looking at. So what we're looking at is we have a November 30th deadline that all of our staff must be fully vaccinated to be able to provide the work. Whether that's somebody sitting in an office, in finance, or whether that's a DSP out on the front lines in the circle of support. All right, it's us. This is a we thing. And I want us to see that. This is a we thing. We're going to do this together. We have to have that done by November 30th. So we have to work our way backward. What does that mean? So today and now, we're talking about and providing information in the chat about how to get vaccinated if you haven't already been. There's a lot of information to answer questions and to address concerns. First and foremost, I will tell you right out of the gate, I will meet with every single one of you if that's what you need. My hope is that you'll have the information that you need from this time together. But if you're like, I need to talk with you, I need to share how this feels, I get it that it's required, but I just need somebody to hear me for a minute, then I'll hear you. Because it's a together thing. We're doing this together. I don't want to lose a single one, not a single one, because losing a single employee means a person who is getting support is not getting that. And it would break my heart if it creates a huge gap in time of the supports that they need. And it also means broken relationships. That person has grown to not only depend on you, but to give to you, right? Our relationships, every one of you that does this work knows it's mutually exclusive. So we've got a lot of resources and information to help you, either have it come to you or how to get to a place to get vaccinated. I strongly, strongly encourage you to do that, not only for your own personal safety in this arena, but also as a practicality, guys. It's coming. The Biden administration has already rolled out, some guidelines of what's coming, and OSHA is working on those emergency protocols. I'd hate for you to walk away from this with very meaningful work, only to find out any employer you go to that has 100 employees or more in the next couple of weeks is going to be required to do the same thing. Let me also tell you this, door never closes. You need to hear that from me. The door does not close. If you get upset, if you're like, I don't agree with this, and then you walk away, and then you change your mind, you're like, you know what? I didn't realize how much it was going to hurt to stop doing this work. I want to come home. I want to get back at it. Fine, let's do that. You come back, you get into the protocol, you know, with vaccination, and let's put you back doing what you were doing. I prefer you don't leave, of course, but I'm not going to close the door on you, because then I'm closing the door on opportunities for people we support, and I'm not going to do that. Okay. On top of that, so there, I know on the minds of many people is, okay, what are our options? Options are, first and foremost, let's get vaccinated. That's the fastest, safest, right at it kind of thing. There are some people that cannot. Their doctors have told them there's a risk for you. I wouldn't recommend that you do that. It's a medical waiver. Fine, bring that. Get your doctor to sign off on that. Say, hey, this is why. Boom, done. We then work with you. Do you have to understand that, you know, certain scenarios and choices have consequences? We all live with consequences all the time. You know, you choose to change lanes when somebody's next to you, there's some consequences, right? But for anybody who has a medical waiver, then you've got to test weekly. Every week, you got to get a negative test so we can put you in shift and get you back out there and at it. We are working on setting that up to be as easy, seamless, and quick as possible. So we're working with some of our insurance providers to literally set up clinics in our own locations. Where I can't do that, we're partnering with other organizations that will be testing locations for us, and you can go there, get tested, and we get the information as quickly as possible, get you back out working. And it's got to be in a rotation each week. You miss it, then we go, oh, can't put you to work till you get it, you know, that kind of a thing. It's going to be a lot of logistics. I'm not going to lie, it's going to be tough. But we value every single person. If you have a medical waiver, I want you here. I want you working. It means you're going to have to wear all the PPE protocols, right, that we have been doing, which has proven to be effective. So I'm super excited about that. It's not like, oh no, what now? We've been doing this for 18 months. We can do it some more. The other option is there are people who your faith walk, your religious background or belief system says, hey, you know, that contradicts with my feelings, my sincerely held belief. And that's I'm saying that on purpose because that's kind of the legal term, a sincerely held belief. That is an option that, you know, for those that hold that sincerely held belief. You will, again, provide a different form that you will attest to that. And we will take that and you will basically be, again, requesting a waiver based on that. There's a couple of questions on there. And then we'll, you know, see if we can make that accommodation as well. My hope is we'll be able to accommodate everybody in all of the different categories. Those are the two waivers. Those are the only two waivers. There isn't, well, my job is this, or I'm only this old, or I'm that old, or those are the only two waivers. Okay, and they're very serious, and there's a narrow band on those. There are two exemptions, and that does apply to us a lot. If you are a roommate to someone that you support, you live in the same household, and that is the only person you provide support to, you're exempt. You know, in essence, it's your own home, right? You can kind of see the corollary there. And the other exemption is if you provide support to your own family member, which we do have family members. We're privileged, and it's a joy that we have family members that work for J. Nolan. But you can only be providing service to that family member. If you work in other circles, then the exemption doesn't apply. That's it. Those are the four: two waivers, two exemptions. And the weekly testing is not, you can't opt out. Now, for the exemptions, there's not weekly testing. So roommate and family member only providing service to those individuals. There's not a testing requirement there. The two waivers there is. And again, if you work in other circles other than your roommate or your family, then you would be in the mandate must have a vaccine category because you're now going into another circle of support. Again, the weekly testing is going to be a lot of logistics. My sincere desire is that we all go forward together, getting vaccinated, being safe with each other and ourselves and the people that we support. There is a tremendous amount of benefit, and the most amazing benefit I see beyond the obvious of the medical safety features that we're seeing is the fact that we get to go forward together, providing this work together, being who we have been for the last 46 years together. We have seen other challenges in the past that have challenged us as a together unit. This is just one. Let's be an example to the community around us of what an organization looks like when it says, we're about the work, we're about the mission, and we will fend off any threat to that. And that's what we're doing. When we go forward together in this new way that we have to do work, it's going to mean we're going to be able to get back out in the community. And we're going to be able to send that message out to community that this is how we get it done. You hand us a challenge, challenge accepted, because we're serving people. If this was easy work, right? Everybody'd do it, but it's not. It takes special people with amazing hearts, and you are those people. We will be giving you more information as we go forward about the testing protocols. The forms will be forthcoming, and you'll see a COVID policy, right? A COVID vaccination policy come out probably early next week. Just get it done. We're fine-tuning it, but it's almost done. Required to do that. So you'll see it pop up in PACOM. You'll have to acknowledge it. And then there'll be additional, the forms for those situations, whether they be waivers or exemptions. And then you'll get those into payroll, and we'll, or not payroll, sorry, HR, and we will be able to review those, get back to you on that. Do those things as soon as possible. Please don't wait till November 29th. Let's get on this together now. Because some of these vaccines, right, have a 21 or 28 day window from first to second dose, get on it now. There's information in the chat where to go. It's free. For those of you that have our Kaiser health plan, it's extremely groovy. You can schedule your appointment. You go in, and not only will you be able to get it there and be done with it, it'll literally be in your app. You have a Kaiser Permanente app on your phone. You can, if you ever have to prove it, because that's coming too, guys. That's a reality of our arena that we live in now. Is you can just show them there it is, right? Don't the card thing can you, God forbid you lose your card nowadays, but you can take a picture of it, and then you also have it in your Kaiser Permanente app. Because just today, the LA County has released some new guidelines. Any mega events, which I'd like to think my birthday should be a mega event, but anyway, any mega events are going to require that they verify vaccination. And now also indoor scenarios where some restaurants may have outdoor seating, because it's outdoors, but they have to verify vaccination to come in and eat within there, or the bars, wineries, which was really important to me, distilleries and nightclubs. All those venues are going to now have to verify vaccination status for indoor service, and that's going into effect now. So these things are happening all around us, and while it is certainly a little bit more significant than some of our other vaccine protocols in the past, you stop and think about it, it really isn't, right? We all had to get our vaccines to go to school, which means you've got it. If you're going to school, you've got it, so nobody's asking you for it. And we're going to eradicate this thing, right? And the human spirit is what's going to win. It's what's going to come out on top. So let's be who we've always been. Let's meet our key results, right? Key result number one is everybody that we support will be living a meaningful life in the community. We've got to be there to make that happen. We've got to be walking alongside to make that happen for them. And key result number three is let's be a demonstrated leader in providing services to individuals with autism and intellectual and developmental disabilities. That is who we are. This is our time to shine and do it together. Again, I know there's lots of feelings, thoughts, politics, all those things that swirl around it. I want to brush that aside for a second, move that out of the way for you to see clearly what it's about. It's about people and us stepping up. I think I covered all the things I wanted to cover. I know our interpreter needs a break, so I'm going to breathe. Vanessa's gonna take a look at our chat, and we'll begin to answer some of the questions in just a minute. So I want to give you guys a chance to stick some in there, some questions if I prompted a question, or if you already had that on your mind. And also Vanessa has a couple of others that she had sent me, but I don't have in front of me. So if we don't get to those, Vanessa, be sure to hit those other three.
Certainly.
All right. Do we have any, Vanessa?
Not as of yet. If you have any questions, please feel free.
Well, while people are typing in there, why don't you go
chat.
ahead and hit me with those others so I don't miss them.
Actually, I think you've addressed a couple of them. One of them was, I have a medical condition that precludes me from getting the vaccine. What would I have to be tested? Is actually the question. Okay, yeah. So yeah, you would provide that statement from a medical professional that says, my doctor has stated I should not get the vaccinations. It puts me at risk. Whatever their terminology, they'll do that right. But they will provide that request for a waiver, and then you provide that to HR, and then yes, you would go into the pool of our employees that have a waiver. And then need to test weekly. And we will be giving you a lot more information as a organization, as a team. You'll hear more about what that's going to look like. There'll be designated days and locations, and we're trying to make it as absolutely convenient as possible, because I want you all on the front lines doing the deal, not waiting in lines trying to figure out where to test. There is a comment in the participation box from Sherry Ramos on behalf of the J. Nolan Board. Thank you for your commitment to the people we serve during this challenging time. And she is the Thank you. Chair. Yeah, it's good to have our board president on here. No pressure on me, huh? I better get this right. My boss is on the line. And here's a question. Is there a specific form for the medical or religious exemptions? So there is a specific form that Jay Nolan is producing. We're almost done, just making sure it's all good. For the religious exemption, the medical one would come from your doctor. You would request that of your doctor, say, hey, you and I have already talked about this. Now my work, I have to have some evidence that, that we've had this chat, and that you as my doctor recommend I not do that. And they can provide that on their letterhead and signed by them. There is an additional question regarding religious reasons for not taking the vaccine. Does anything need to be signed by a clergy member? It does not. That's a great question, by the way. No, it does. It does not require that a clergy sign that. Religious belief and a spiritual life has been recognized by the Supreme Court as being a much more individual journey and path. While yes, you may be affiliated with a church body, and that's your faith walk choice, it is not that a clergy is somehow an authority over your spiritual life in a legal sense. Where medical it is, because there's some very specific things, and we trust our medical professionals to shepherd that. So that's a little bit different. So it's a great question. No is the answer. It's you that's signing it actually on the form. The next question is, what is the process for a roommate exemption? You know what? I think we're also creating another form for that. And it simply will be a checkbox, actually, that you say, I'm a roommate, and we attest to that ourselves, because we're like, yeah, we hired him as that. And we probably maybe put your address on the form, something along those lines. And that one's also almost done as well. The next question is, if we're forced to get vaccinated, are we going to be forced to get boosters all the time? That's questions come up before, and it's kind of an interesting thing. I guess it's going to depend on what our medical community kind of tells us. Because again, while vaccinations aren't new, and even requiring people to have vaccinations to access, like educational services, those kinds of things is not new. Boosters aren't new either. We've had tetanus boosters for decades. Because it does lose its effectiveness, over time. And so, I don't know if you've ever gone to your doctor and you're like, oh, your checkup, and like, oh, you're due for your tetanus booster. And then they give you a shot, and the next day you feel like somebody punched you in the arm.
Yeah, so there is no discussion at this point from, that I've heard, that our chief, the chief medical officer or any other, arena that has authority at this point about requiring a booster. There's a recommendation, particularly for people who are medically fragile. So even some of the folks that we support, it's highly indicated and recommended for them and is open to them. Right now, there is no other conversation with regard to that.
An additional question was, what happens if a family has been okay with working with an unvaccinated staff member and they change their mind now and staff do not get vaccinated? The family or the individual?
Right, that's a great question, and it kind of let me sort of separate a little bit. The preference of the family for vaccinated and not vaccinated, like, hey, we don't have a preference, it has kind of been taken off the table because the state, has now mandated that all of us have to be. So whether they're like, hey, we still don't really care, unfortunately, we don't have that option anymore. And they may, staff may, support individuals may change their minds and say, hey, we only want vaccinated staff. That's obviously within their rights to do that, but it's already happening for us anyway, because as an employer providing these services, we're required.
There was an additional comment from our Family Services Director, Cindy. If you are requesting a medical exemption, your medical professional writing the exemption should not contain an actual diagnosis, and it's not necessary to have a reason other than the medical professional believes for your condition, you should not be receiving the COVID vaccine.
Thank you, Cindy. That's a really good point. Yeah, it will not require the diagnosis. If they put it on there, we just want to be very, very careful with that personally identifiable, what they call HIPAA protected information. So our preference is they wouldn't put a diagnosis. They would just, as Cindy said, indicate their recommendations as your doctor. And that's all that's required. And I'm happy about that, to be honest.
There is another question regarding religious beliefs. Someone asks, are religious beliefs denied? Also, if you have a chronic medical condition that falls under the Americans with Disabilities Act, you have a doctor's note attesting to that, does that count?
Yes, yeah, okay, so two questions. Is a religious waiver denied? I've always been
it actually said religious beliefs.
Right, well, your beliefs, yeah. So your religious beliefs are your beliefs. So I've always been a transparent guy. So I'm going to tell you just kind of real plain and simple how I see this. Your religious beliefs, and if you're at request a waiver based on a sincerely held belief around that's between you and your God. I'm not here, and neither is HR, to be the religion police. That's not how we're going to deal with you. We're going to deal with you as a individual we respect and value as a member of our team doing this great work together. And we're going to trust you're going to make the decisions that you feel are the most appropriate to make in your personal life and your spiritual life. So we're not going to really get into this like, hey, your beliefs are valid and your beliefs are not. It's not my place. It's way above my pay grade. And then as far as the chronic medical condition that would preclude you from getting the vaccine, again, having your doctor just sign a form that you can bring in that says so, done. But you will have to test.
And there was an additional question in that regard. I'm not sure if this was touched on, but will someone requesting a religious waiver need to be required to test weekly?
Yes.
Yes,
you will have to retest weekly. The two waivers, a medical condition or a religious, sincerely held religious belief, both of those granted waivers, because they are a waiver request, both of those granted waivers. And the reason, yes, we'll have to test. Why I say that, they are waiver requests. And the scenario is, can we make the accommodation? And so, as brought up by somebody else, if you're requesting that waiver based on a sincerely held religious belief or a medical situation, but the family that you work for only wants staff who have been vaccinated, then we won't be able to make that accommodation. We may be able to connect you with another opportunity to work at J. Nolan where that will be okay with someone. They understand, they say, look, I'm fine with that, here's why. PPE is fine for me, all is well. That's fine for me. So it's important to recognize there's the waiver request, and then can Jay Nolan make the accommodation? My promise to you is we will do everything in our power to make those accommodations. But I can't promise you I can make them all, or we can make them all, because of, again, individualized choice. The individualization of our services means some families have their own take on that, and we have to honor that, as we've been doing already, you know that. So that's why I kind of say the waiver is a request, and then the accommodation is, can Jay Nolan make this reasonable accommodation? My hope is that we can. My hope is we can have a dialogue, you know, even with that family, and say, well, here, you know, the individual wants to continue to support your son or daughter, or wants to continue to support you if it's that individual, and maintain this relationship and walk this path with you. There's some limitations for them to not be able to do this, and here's why. And that has to be completely okay with you, to have the level of conversation you want to have with that, and see where we can go with that. So I want to have that clarity there. Good questions, everybody. Thank you.
There's another really lovely comment from Vicki Johnson. The board is in awe of the work you do as well. Vicki Johnson, secretary and parent of the son saved by GMCs.
Thank you, Vicki. Great to have our board here. And they deeply, deeply appreciate the work that you do. I stun them with how awesome you are every board meeting.
I had one other question here. How would we know people aren't using religious exemption just to not get vaccinated, was the question.
Yeah, I mean, it's a fair question. And the simple answer is we don't, right? That's why I said, you know, that's between them and their higher power, however they perceive that. And my hope is, as you know, you kind of go through this and you think about the things, you kind of, you engage with, you know, thoughts and feelings around it. You think about the person you're supporting, and you make the highest and best decision that you can make, putting others before yourself. That's what being of service means. That's what I do. That's why I'm in the role I'm in. This role is for me to serve you. At the end of the day, that's my job. In case you're all wondering, what is the job of the CEO? The job of the CEO is to serve all of you, to make sure that you have what you need to make the mission real in the lives of people every day. You're not here for me. I'm here for you. And that's why we're having this time together. That's why we're sharing this information, and my desire for us to continue to walk forward together, so you understand that everything I do is through the lens of the mission. Doesn't mean I like everything we have to do, right? Payroll, taxes, you know, things like that, but we have to do those things, right? And my promise, right? The promise we all make, right? There's over 600 of us as members of the Jay Nolan team. And my personal belief is that all 600 of us make this promise every day to the people we support, that we'll be here today, we'll be here tomorrow, and we'll be here 90 years from now to continue to provide services to people because we believe in it. And so we're today setting up the future for those people who come after us and do this work. And they'll be able to take pride in the fact that every challenge, you know, given to us, we accepted the challenge, we met the challenge, and we kept at the mission. This is just one of them, just one.
We have two more questions. I am a roommate and my husband only works one weekend with my roommate. Would he be able to use the roommate exemption?
Well, does he live there? I'd have to answer that question. He would have to reside there.
A little bit more clarification.
For the roommate exemption, he would need to reside there.
And one other question was, I have a question regarding job security versus non-vaccinated employees. We could probably use a little bit more clarification. And the previous question, yes, they reside in the same home.
Yeah, if that person works with only the same person as in the home and lives in the home, but like you're saying, maybe he only covers the weekend shifts, my interpretation of that would be that the exemption would apply. But let's make sure we just have a little bit more conversation individually about that. But as I understand the question, then, you know, they live there, they work with only that person, the roommate exemption applies.
And I'm sorry.
Sure.
That latter question was really just a concern about job security.
Yeah, I don't blame you. I don't blame you. Job security is it's a scary thing, right? I don't want you to be scared. Here's the reality is I don't want you to be scared. I want you to be part of this team. And I want us to have a conversation and find our path forward together so that you can continue to do the work you're doing. And again, that's whether it's, somebody in finance, or it's somebody providing support on the front lines, or it's a supervisor. We have to deal with what's, the hand that we're dealt, right? And we've certainly got a challenge, right? Logistically to do all of this. But, 2/3 of our organization, we know for sure with all the attestation we've done already, 2/3 of our organization is already vaccinated. Yay, awesome. This other third, let's get together. Let's get vaccinated, or our necessary waivers or whatever done, and we'll get our testing protocols in motion, and we'll move forward together. Job security, I can tell you one thing as far as job security goes. I mean, there's never any promises on this side of eternity, but I want you here. I'm quite certain you're the person you support wants you here. This is great work to do, and I wish you'd go find me 10 more people as awesome as you to do this work, because I right now have 52 openings in one department alone. It's a very difficult hiring time. I don't want to lose any of you, because it's going to translate into difficulty for the people we support, broken relationships. So if it's a struggle around not wanting to get vaccinated, or if it's a struggle around, hey, look, I've got a medical condition, I can't. Those are different kind of conversations. Let's have those conversations.
And that person actually clarified a little bit more with asking if there was a place here for them without health or religious exemption. Would they be able to work for JNCS?
If they did qualify for a religious exemption?
Right, would they still be able to work with JNCS?
Okay, so that's the challenging one. So that's the answer is no, which is why I said the conversation is a little different depending on what we're talking about. As of November 30th, that is taken out of my hands. The only exemptions are, roommate or an individual working with a family member, and only that family member. Those are the exemptions. The only two waivers: medical condition, sincerely held religious belief. Those categories have to test weekly. Those are the parameters with which we're working in. Everybody else, like me, for example, if I hadn't already been vaccinated, I fall into the you need to get vaccinated category. So if it's that I don't qualify for an exemption or a waiver, then we're having a conversation about getting vaccinated and what that means, and the thoughts and the feelings you have around that, and can we make a path forward for that for you? Because I don't want you to go. I don't want to lose you. I want you here. And the reality is, guys, as I mentioned before, it's coming for just about every employer, we have in the state. I mean, yes, very small places, you might be able to find a place. They're out there that have less than 100 employees that have decided they don't want to do it. That's fine. There's a lot of scary liability stuff that goes along with that, but they are out of the scope of the mandate. But you have to go hunting for that. Other option is to stay here and do meaningful work. Be proud of the day's work that you've been able to do, because you're making the difference in somebody else's life. And you're sending a loud and clear message you care about them.
Okay. If there are any other questions, now would be the time to type them into the chat.
Everybody's being compassionate to the interpreter and pausing for a minute. And their last question is a great question. When can we have one-on-one conversations? shoot me an email. We'll find a time to put it on the calendar. I expect I'm going to be busy in the next few weeks, you know, doing these, you know, having these conversations. I'm happy to do it. So send me an email. I'm real easy. I'm edward@jnolan.org. And we'll set that up. My hope that you get from this conversation today and the ones we'll have ongoing, and this is me true, just being very open and transparent with you, is I may not know each of you, you know, in your everyday life and all the work that you do, and maybe we even haven't had a chance to meet. But don't mistake the fact that we haven't had a chance to meet. That doesn't mean I don't care about you and I don't love you. I do. That's why this is hard and why it hurts at the idea, just the mere idea of somebody no longer working for the organization around us. Because it matters. You matter. The work we do matters. And I don't want this to get in the way of that. I don't want a really cool career path and opportunity change for you around this. And I don't want any broken relationships.
We have another thoughtful comment here. It's a hard conversation to have, but at least we have the opportunity to chat with you and ask questions. Another one thanking you. I appreciate you opening up the space for us to ask questions. And
Absolutely.
Appreciated.
This is also not, it doesn't end here, right? Just this is the beginning conversation. If you think of a question, or you're like, I didn't really want to type my question in there because I'm kind of self-conscious about it, or it's personal information, that's fine. You can reach out to HR and have the conversation. June or Rocio or Anna, any of those team members can work with you on that. Zach, of course me. You can reach out, you can talk with me. So this is not the last chance you have to ask questions by any means. We're walking this path together, and this is a marathon, gang. This is not a sprint. We got to kind of come out of the gate a little fast because of the timetable they gave us, but we'll do this together. We'll get there.
Okay. I think that sounds like it's wrapping up our town hall meeting. Thank you so much, Edward. Thank you everyone for attending and participating and asking your questions. Again, this meeting is being recorded and will be available in the next week and emailed out via our newsletter. And will include, of course, an English and Spanish transcript, as well, of course, our friendly interpreter, Romina, providing our ASL interpretation. Thank you so much for attending.
My thanks to all of you. My thanks to Romina I know I talk fast, so I really appreciate her. Thanks to our board of directors for being on with us. And again, thank you for the work that you do every day. You're changing the world one circle of support at a time. So thank you. Have a great rest of your evening.